It's the uterus's way of getting back in shape. Over the next few weeks, it'll contract back to its pre-pregnancy size. The body's ability to recover and heal after such an intense process is truly remarkable. The process kicks off with a hormonal surge. The placenta and the baby's brain team up to release signals that basically say, it's go time. Two key players enter the game, oxytocin and prostaglandins. These hormones bind to the uterine muscle and boom, contractions begin. As these contractions intensify, they start working on the cervix. The cervix is like the gateway to the uterus, and it needs to open up for the baby to pass through. This process, called effacement and dilation, is pretty incredible. The cervix starts to thin out and open, creating a passage for the baby's descent. It's like a flower blooming, but way more intense and purposeful. Each contraction is like a wave that starts at the top of the uterus and surges downward. It's nature's way of guiding the baby out. These contractions are doing some heavy lifting, literally pushing the baby lower and lower into the birth canal. The baby isn't just a passive passenger in this journey. They're an active participant. The baby's head starts to rotate and flex, aligning itself with the mother's pelvis. It's like a little gymnast, maneuvering through a tight space. This rotation and flexion are crucial because they allow the baby's head to match the curve of the birth canal. Nature's engineering at its finest, folks. We're in the home stretch now. This is where things get really intense. We've got the transition phase where contractions are at their peak, the cervix is fully dilated, and the baby's head is making its way into the vaginal canal. It's like the final push in a marathon, tough, but so close to the finish line. Then comes one of the most dramatic moments, crowning. This is when the largest part of the baby's head becomes visible. The mother's body performs an incredible feat of stretching. The perineum, the area between the vagina and anus, stretches to accommodate the baby's head. After the head emerges, it turns slightly to allow the shoulders to follow. One shoulder slips under the pubic bone, then the other, and the rest of the baby follows quickly. Minutes after the baby is born, the uterus continues to contract to deliver the placenta. This organ that's been nurturing the baby for 9 months now needs to make its exit. The uterus contracts, the placenta detaches from the uterine wall, and out it comes. It's like the encore after the main performance. The uterus, which has been stretched to accommodate a full-term baby, now begins a process called involution. It's the uterus's way of getting back in shape. Over the next few weeks, it'll contract back to its pre-pregnancy size. The body's ability to recover and heal after such an intense process is truly remarkable.